On the Medical Watch tonight, medicine is sick. Studies show 43% of nurses and more than 20% of doctors are leaving the profession.
In part 2 of our series, medical reporter Dina Bair takes a deep dive into the medical field to document ongoing problems and possible solutions.
After last week's story, where we spoke with 2 nurses leaving their bedside jobs, we heard from many of you, our viewers, who thanked us for tackling this topic and discussed the woes in medicine. The one thing everyone on the front lines agrees with is administrators need to listen. So tonight, we talk with 2 people tasked with running one of the city's major trauma centers, how they're trying to treat patients and heal a sick industry.
We have beds open in case we get any traumas. We ready? Okay. My name is Candace Toe-Free-Ross, and then if anything changes as far as sitters or patients going bad, I am the nurse manager for 5 North. So we'll check with medical step down to make sure that we don't have any issues. I've been here for 6.5 years. My father worked here several years. He used to tell me about all the great stories Mount Sinai have to offer, the type of patients that we worked with, so I knew I wanted to be a part of it. This is a surgical ICU. This is where all of our traumas come, whether it's a fall, whether it's gunshot victims. Okay, because that's our goal, to make sure that we're supporting you all. I know this is no problem. It's been a rough 2 weeks. The patient fell off the roof, so it was a sudden event. So the doctors told them a week ago that the prognosis was very poor. The daughter is in Mexico, so the social service team, the nursing team has been working very, very hard to try to get the daughter up here. Her number one concern is she wants to say goodbye to her dad. Unfortunately, we've been at this for 2 weeks now, and it's looking very grim that she'll be able to come up here and say goodbye. And we have to be the ones to deliver that bad news. No, we're so sorry. You can't say goodbye. And that's really hard. It weighs heavily because we're human, you know, and the first thing is we have those emotions.
There's some patients, there are some family members that over all these years that I've done this, and as an intensive care nurse in the beginning, I still see them. They always stay with me. My name is Jean Blake, and I am the System Chief Nursing Officer for Sinai Chicago.
How long have you been a nurse?
A long time. You're going to make me give my age away here. 44 years this month. This is my office. This is where I spend an awful lot of time. This is running lists of things that are needed and what has to be done. Check marks mean I took care of it.
Talk about the last 2 years, because I know in COVID things were really tough.
COVID has done a number on the nursing profession and all medical professionals, first responders, physicians. It's been a very taxing time to the extent that some have chosen to walk away from the profession.
What's it like day in and day out?
There is a theory going around today, and it's called moral fatigue. And I think a lot of nurses after the pandemic and during the pandemic experienced that, because you see patients that probably are not going to get better or are miraculously getting better. So you have tremendous ups and downs in the course of a day.
If someone on your staff came and said, I don't know if I can do this anymore, what do you tell them? What's your advice?
That's not uncommon. I tell them to take some time away, you know, whether they take a week off or a couple weeks off, and to really think about where they've come in their career and what the actual obstacle is as to why they think they can't continue. And very often they come back refreshed and say, I'm okay, I can do this. There's very few hospitals, if any, that are not, you know, experiencing a shortage of personnel. Recruitment is tough. There's a lot of competition for the nurses that are out there. The agency rates that we have to pay to supplement are enormous. We've offered incentives, we've increased base pay, we've done things from a financial perspective that has been helpful to them and to try to match the market in many ways.
But it's not an unending flow of money. I mean,
It's not.
Is there anything you need from us to help you when you get discharged?
I need some clothes. They took all my clothes.
Okay. We are working in an underserved population, so we notice a lot of our patients didn't have clothes to wear home. I have shoes and jogging pants and t-shirts. A lot of patients come in for trauma. They try to treat the patient, of course, so sometimes it means that they have to cut their clothes off. I try to keep it refilled every week. I go shopping and make sure that they have enough clothes to wear. That will always be my mission. So that's probably one of the traumas coming in now. Yeah.
We can get multiple penetrating traumas in a row, and they come in stretcher after stretcher after stretcher, and that's what we do.
I had an incident today where the family member was very, very upset because her young daughter was shot. So she was crying, very, very out of control. We have to put ourselves in those situations and understand that we're working with mothers and fathers. They're human. It gets frustrating at times. Because families don't always know how to articulate, I'm angry, I'm sad, I just received bad news, so they lash out. So sometimes it can become emotionally draining.
As a young girl, would Jean go into nursing again?
Yes, I would. I would do it again, but I would encourage people to understand how much they will give of themselves to go into this field. This is a job that requires not just hands-on and skill sets, but it's a heart. It's your heart. It's what you do. It's what you give.
Next week, physicians committed to their profession and each other both walk away from their jobs. Their insights on Tuesday in our continuing series, Medicine is Sick. Back to you.
And our Medical Watch team is working to